Welcome back. This is still Good Morning Nigeria, live on the network service of the NTA. And to kickstart our conversation this morning, which is on brain health for all ages, let's take a look at this insightful background report put together by Oyeyemi Ajayi.
The brain, referred to as the power of the human body, a very indomitable internal organ of the human body, which every body part is connected to. Primarily, it's good for thinking, but its job goes beyond that. It sends signal for reaction to any situation. Hence, with its overwhelming role, more attention has been said to be paid to it in order to enable effective functioning. The brain is arguably the most important organ in the human body, as it controls virtually everything we do, from basic functions like breathing and heart rate, to complex tasks like thinking, feeling, and remembering. It acts as the central commander, receiving information from our senses, processing it, and then directing actions and responses. However, keeping the brain healthy, like many say, is very essential towards a healthy living. But over time, research shows the unhealthy lifestyle towards the healthy brain, which has militated growth and development. The brain health is significantly influenced by its combination of modifiable and non-modifiable factors throughout a person's lifespan. However, some have highlighted major strengths for a healthy brain to include cardiovascular health, mental well-being, lifestyle choices, and social determinants of health. Experts believe having a good night rest helps to boost the brain, aside challenging the brain, being careful of the medicines digested, alcohol limitation, physical exercising, meditation, eating brain-boosting food, amongst others. The topic of brain health has been included in World Brain Day events for the past 4 years, emphasizing disability and prevention. However, as the world commemorates the day with this year's theme, Brain Health for All Ages, it highlights the importance of brain health and neurology for all age groups across the lifespan and differences by world regions, stressing equitable access to care for all worldwide. The Global Burden of Diseases, Injuries, and Risk Factors Study 2021 raised awareness of age-related differences and unequal distribution by income of neurological disease burden. It further acknowledged that 43% of global burden of disease is neurological, a concerningly high number, while emphasizing that a different approach to mitigate the burden of neurological disease might be needed. How more can the brain be kept healthy? A major question our guests will be answering shortly.
All right, many thanks, Oyeyemi Ajayi, for that background report. And to begin our conversation, right here in the studio, we have Professor Andrew Zamani, who is a professor of clinical psychology. It's a pleasure to welcome you to Good Morning Nigeria.
Thank you. Good morning.
All right. Let me also welcome Dr. Hafiz. It's a pleasure, too, to welcome you to Good Morning Nigeria.
Good morning. Thank you for having me.
All right. Dr. Haruna Hafiz is a consultant neurosurgeon at the National Hospital, Abuja. Good to have you join us. And also here, very interesting, of course, is Engineer Chika Okolisa, Executive Director, Brain and Spine Foundation, Africa. Many thanks for joining us, ma'am.
Thank you for having me.
All right, let's begin the conversation. Let me begin with Dr. Hafiz. Just walk us through what it means when you say someone has good brain health, and what does it mean not to have one?
Good morning once again, viewers. Well, let me start with the normal brain function. And of course, when we understand how the brain functions, then we'll be able to know when something is going wrong. The brain is just like if you have a computer system, the central processing unit. It processes and coordinates all the entire activities of human body and human life. Your executive functions. You want to plan your day. You want to take some executive decisions. Wake up in the morning, to take your breakfast, brush, all those things. So the brain coordinates that. The movement of your body, entire body system, your hand function, leg function, the way you talk, the way you walk, the way you speak, it coordinates and regulates that. Your gastrointestinal system, the entire body system, the brain sends signals, gives command, gives a control, perform that role over the entire body system. So whenever you notice there's anything that deviates from that normal function, that's when you know that, okay, there's a problem. If you see someone that's, okay, naturally, okay, this person is a calm person, and suddenly became aggressive, yeah, there's a problem. There are certain clinical manifestations also that will let you know that something is really wrong. For us neurosurgeons, once we see someone that's convulsing, we know that, okay, something is abnormal. It's not normal for someone to be convulsing. You know that, okay, especially an adult who has been otherwise normal throughout his life, start convulsing. So the teaching is that the first thing that you must look for a brain tumor. There's a tumor growing that is altering the normal function of the brain.
Doctor, you talked about being aggressive. Someone who is calm becoming aggressive, then it means something is wrong with the brain. I'm thinking, there's many things that make people aggressive. You don't have money in your pocket, or maybe your wife annoys you. You can become aggressive. Does that mean that all of this affects the brain?
Absolutely. It's not only organic problems that affect brain function. Psychosocial stressors. I'm sure Prof will shed more light on that. You are driving. I'm just on my way. I've done school runs this morning to drop the children. I was just at the top speed to catch up with this program, and someone just called me from the house. That, excuse me. Calls me that, hey, Pampers has been, to disrupt. We almost jammed it. Excuse me. What am I thinking about? What is this one talking about? So it disrupts, your normal thinking process, line of thought. Psychosocial stressor. Money. It's a big factor in this part of the world. You see people driving abnormally on the road. The guy is thinking of probably hasn't paid house rent. The landlord is flogging him. He left the house without leaving, what the family will put into their stomach. He's struggling to troubleshoot, especially men. You ladies, you are still enjoying. The men, the burdens on men, we start thinking troubleshooting, paying school fees, all those things. We are trying to study something. We discovered that this period of the year, so many people bleed into the brain. Hypertensive bleed. I just called the attention of my colleagues. We need to do a study on this. Why this period? Almost every day we see a patient that bleed into the brain.
What is responsible for that?
Most of them are hypertensive. They are not aware. That's the number one factor. Then coupled with the psychosocial stressor, someone struggling to pay school fees, all those things.
Fantastic. Prof, I'd like to find out from you. When Doctor was speaking, he talked about troubleshooting. And when he compared the brain to the computer. So I'm thinking that how long would you continue to troubleshoot when you have all these problems? Will the brain eventually shut down? Or what are the signs that you have reached the peak of all the stress and all the conditions that are stressing your brain?
Well, it depends. Yeah, it's a very difficult question.
Absolutely.
Will the brain eventually shut down? I think it will, because our doctor has just said it. And when it shuts down, that's death, I guess.
Absolutely.
Yeah. Once it shuts down, that is death. But it can be overburdened. And one of the manifestations of a burdened brain, of a stressed human physical system, is this high blood pressure that is usually responsible for what he called bleeding in the brain, because there's a rupture of the blood vessels in the brain, and so you get a physical manifestation. But you see, there's a thin line between the mind and the body. And so whatever affects the brain affects behavior. And that is why he quickly told you about psychosocial stressors. Road rage, for instance. You know, somebody who is prone to hypertension or who is prone to coronary heart disease, of course, which is brain-related, could just easily get walked up in traffic by someone who is just a rascal. All right? He could just get walked up in traffic by a law enforcement agent who is a corrupt dude. All right? And so once there's a spike, something happens. And sometimes you can even experience sudden death. So it is really very, very important that we pay attention also to psychosocial stressors. Unfortunately, not many of us are mindful of how we live with ourselves and by ourselves, and how we live with other people. It is unfortunate also that we are not mindful of how we communicate with each other, either verbally or non-verbally. And so all of these things affect brain health. I'll give you an example. In a family where husband hardly talks with the wife because he's keeping malice about something that she did maybe 3 days ago that she's not even mindful of. But because he enjoys the control that he has over her, when he withdraws, refuses to talk to her, and that makes her miserable, he continues in that line. It's even worse when she comes to ask what is going on. Can we resolve it? What have I done? Please forgive me. And he just enjoys pathologically the pain that he's putting her through. You know, all of these things affect brain health.
All right, but is brain health same as mental health? Even though I would have preferred you used you switched your the instance you were given that women are much more capable of doing that. But is it the same thing when you say brain health, mental health, which has become very much common these days?
Absolutely. Absolutely. In this context, yes. Because he just said that the brain is a central processing system. Take the brain away and there's no mental health.
All right.
Okay, let's get to engineer. You know, I'm thinking at this point.
Dr. Tabo.
Okay, by the way, we have joining us now for the conversation Dr. Christopher Otabo, consultant trauma surgeon. Many thanks for joining us, Doctor.
Thank you for having me. Good morning, Nigerians.
All right, we'll get back to you shortly. You saying that mental health and brain health, one and the same. I'm thinking that is it that in the past the brain was stronger to deal with some of these issues compared to now? I said that because these days you hear Gen Zs talk about I'm protecting my mental health. When you talk to them a certain way or you try to hit them, they can't relate with that. But in the past, when we're growing up, of course, we know the things we went through and we survived. Our mental health was not disturbed. So what is happening? Is it that there's a shift in the way the brain behaves, or is it that there are factors affecting mental health issues these days? I don't know. But let's get to engineer. Chika Okolisa, Executive Director of Brain and Spine Foundation Africa. First and foremost, tell us what your foundation does, and tell us, is there a shift in is it that there are factors that are responsible for the mental health conditions we're seeing these days compared to the past?
Okay. First and foremost, I want to say that from from what Doctor said, in our society, we have gotten used to mental health than brain health. And as an organization that is dedicated to creating awareness of neurological conditions, advocating for policies, and supporting the affected individuals, we have come to understand that a lot of people don't understand what brain really entails, how brain functions or works. You see people walking, what they are just bothered is just the mental health, whether they are depressed or not. But the main issues are neglected. So we try to educate people that mental health, in as much as it is the same as the brain health, but it's a fraction of brain health. Brain health is, in itself, is not a moment in time, it's a lifetime commitment. This year, World Brain Day is brain health for all ages. Brain health for all ages is a call to action to see how to protect neurological well-being from the earliest stages of life, from childhood to adulthood, into the older stages of life, into the older age. We as a society need a lot of education, awareness to understand the season that we are in. Doctor made mention that this season, that they are getting a lot of patients bleeding in their brain. It's too much. As an organization that is, burdened with trying to support individuals that are having brain emergencies, neurological emergencies, the request that we get is something else these days. I tell people that one of the major risk factors of having a stroke these days is residing in this crime, this Nigeria. I don't know whether it happens in any other country, but the rate in which people are slumping, dying from brain hemorrhages, is rising, is increasing at an alarming rate. And I'm worried, it's worrisome. We have to do something. We have to do something as a nation, as a people.
Are there factors responsible for the increase that was experienced at the moment?
Just like Dr. Haruna has said, also Prof has said, increase in stress. Our brain gets to a limit. And because also we don't listen to our brain, our body, we are always in a hurry. We are always on the move. Let me share an example. There was a day, or sometimes we take some nurses and doctors and go to a very populated bus stop, and we mount an ambulance there and start checking blood pressures of people that are passing, going to work. In fact, on many occasions, we have bundled people into the ambulance and rushed to clinic. Say, no, you are in danger. You are, you are an emergency walking on the road because their blood pressures are on the rise, and they're telling you no, they're rush. I say, no, you no rush. I would ask the nurse, please hold him, put him inside the car, rush him to the hospital.
And this boils down to people not being aware.
People are not aware. Yes.
So how much does your work bridge gaps in terms of creating awareness and access to care?
We are trying our best, but we need a country that understands this brain health, the investment that it requires. Because it's one thing to educate people, it's another thing for them to be aware, and then they don't have the resources to do what is needed. I have seen a lot of patients, they have diagnoses, those that we have helped Sometimes we have helped them to have diagnosis. We have helped created access to a neurosurgeon, to a neurologist, subsidized rate for consultation, and then they don't even have money for maybe CT scan or MRI scan. We try to see how to assist, and then the diagnosis came, and nothing again. You know what it takes to treat, to manage, to rehabilitate, and they go home. What do? They continue their daily lives. I don't know if you're getting me. So they continue their daily life. So it's a very big problem, really. It's a big burden.
All right.
Yes.
Let's get into this big burden. Let's get a bit deeper and bring Dr. Christopher Otabo into this conversation. Dr. Otabo, thank you again for joining us. And I'm wondering, what exactly happens, when to the brain during severe physical trauma? And we have advancements in neurotrauma management, for instance, in Nigeria today.
Okay, thank you once more for having me. I'd just like to throw a little more light on the distinction between the brain and the mind, because it's important that we put everything in perspective. Or mental health, rather, brain health and mental health. The brain can be likened to the hardware of a computer system, while the mind is likened to the software. That's why we have different specialists that take care of issues that borders on each of them. The neurologist and the neurosurgeon, they take responsibility for issues that have to do with the brain, largely, while the psychiatrist takes care of issues that has to do with the mind, because the mind is intangible. When people want to point to their mind, they point to their brain. It's an error. The mind is not a physical thing. So just to clarify that, yes, coming to trauma and how it affects the brain. There are different grades of trauma, different levels. When the brain is exposed to a trauma that is within the elastic limits of the brain, the individual can just go unconscious momentarily, and then he or she can regain consciousness not too long from then. But if the trauma far exceeds the elastic limit of the brain, then the unconsciousness can be on for a very long time. And so we talk in terms of scoring. The most popular scoring system is the Glasgow Coma score that helps us to determine the level of severity of the injury to the brain. So we have mild, moderate, and severe, depending on the score. So, and there are other scoring systems too. Then when you do imaging studies, you can now tell what is going on inside the skull. Though starting from the skin, and then the skull itself, it can be broken. Then what's more important is the content of the skull. So we want to check if there are any areas of contusion in the brain, if the brain matter itself has received some bashing, and therefore you can see the changes in the area where that injury has occurred. You also want to check whether there's bleeding. Bleeding is a common problem for brain trauma because the skull is unyielding. So when extra blood comes into that space, the pressure effect on the brain tissue alone is enough to compromise the patient. So many patients don't even survive massive bleeding in the brain. It can be on the brain, which means the blood vessels on the surface of the brain. It can be in the brain, which means blood vessels within the brain. Whatever happens inside the brain, it manifests in the body. So if the right half of the brain is affected in this trauma, the left half of the body will be malfunctioning, and vice versa. In recent times, yes, with advances in imaging like CT scan, MRI, and stuff. So, and the neural navigation system, we are able to quickly diagnose patients that has trauma, and then we intervene. There's something about brain injury that must be emphasized. That is the concept of time. Time is brain, and brain is time. If a quick intervention is reached, the person will survive. If not, the patient will die. And the logistics of trying to get, oh, there's no CT scan in this hospital where the patient first got to. By the time you are getting to the third hospital before you can get a CT scan, sometimes in some government hospital, I don't want to mention name, if you go there for a CT scan, they will tell you to come back in 1 week, maybe because of the pressure and all that. I'll give you one example before I wrap up. A young man was walking in the field. An electric pole fell on his head. He just went flat unconscious right there in the farm. They rushed him to our hospital. And so from the ambulance or from the car, we took him straight into the CT scan room. Following the scan, we saw massive amount of blood in the brain. It was already pushing the brain and causing a lot of pressure. We didn't take him to the A&E. Thank God the neurosurgery team was on ground. We took him straight to the theater, evacuated huge amount of blood. The next day, the young man was sitting on the bed, drinking tea. That was someone whose Glasgow coma score was 3/15. That's the lowest that's the least even dead would give you 3/15. And so that's to tell you that he was in the deepest coma. If that guy if his brain was not scanned immediately and surgery done within that hour, it would have been history. So infrastructure availability of specialists and the organized neuro system goes a long way to save lives following brain trauma. I'll stop there for now. Thank you.
Dr. Otabo, you've made it more scary. Infrastructure, medical personnel. I mean, the prayer is nothing happens to your brain, really, because I mean, it's not a good position to be in. But I'd like to get to you, Dr. Hafiz. You know, apart from physical injury, which could affect the brain, like the example Dr. Tabo just gave, you know, you talked about other stressors, I mean, that could affect the brain. I'm asking, are there factors that determines the health of the brain? I mean, lifestyle, nutrition, genes, do they affect how the brain functions? Because, for example, there are certain things that could happen to the same, I mean, to two different people, maybe the same thing, right? Another person takes it calmly and is moving and is okay. And the other person is knocked out. So speak to us about that.
Thank you once again. Yes, so many factors affect how the brain responds to trauma or to any form of injury. The genetic factor is there, as you said, even traumatic brain injury. You see a patient that comes in deeply unconscious, you scan the brain and you virtually find nothing. No, as Dr. Tabo said, you won't see hematoma. The patient is deeply unconscious. So there are actually some genetic factors that actually have been studied that contribute to the worsening or the deteriorating level of, you know, the consciousness of the patient, even with minor trauma. So, but largely, the more the impact, the more severe the injury is likely to be. Do you understand?
Lifestyle, nutrition.
Oh, nutrition, yes. Nutrition generally affects any part of the body. Every part, or the entire body growth. Normal nutrition actually, plays a very good, a significant role in development of the body generally. So the brain is not an exception. So your normal balanced diet is okay for the brain. So people talk of, okay, having a food rich in multivitamins. The vitamins, especially vitamin C and vitamin E, they have been found out to be antioxidants. Antioxidants are actually very important in protecting the brain. So those are some of the factors that can also... Let me just quickly talk on... Sorry, I have to go back to the issue of brain health and mental health. The brain is the anatomical structure. Anything that disrupts one of the functions of the brain is just that mental aspect of it. There are so many other functions of the brain. So you may use it interchangeably, yes, but it's not really 100% synonymous. Your brain has other functions apart from what we regard as the mental function. If you talk on mental function, it has to do with your processing, your function that has to do with your intelligence, has to do with your executive functions. But the other parts, as I said, control of movement of your limbs, control of your heart, and also your gastrointestinal tract, the way you listen, the way you see, the brain actually gives a command. So, but anything that affects the brain health definitely will affect the mental health.
You talked about intelligence, and I'm thinking, why is one child more brilliant than the other? Is it that the brain, for one, is more developed than the other? So speak about that in terms of...
Yes, that may be a responsible factor. For instance, the babies that are born with hydrocephalus. Congenital hydrocephalus has to do with water within the brain, water pooling within the brain, thereby preventing the brain from growing. If the brain is not growing adequately, definitely it's going to affect the mental function. The brain has 2 layers. You have the gray matter and the white matter. The gray matter is actually the center of the intelligence. So, and that's what the studies have shown. The more your gray matter, the more your level of intelligence. Other factors contribute to intelligence. The social factors, the environmental factors, your age. You can't expect a baby they just gave birth to have high mental function like me. I can't expect someone who is approaching 100 years to have the same mental, same level of intelligence as someone who is in the 30s or 40s. As we are growing older, and that takes me back to your question, what are those things that actually affect brain function? I think you asked something like that. Exactly. Are there factors? Yes. Age has to do with it. A young child, a secondary school, a primary school child, all he knows is just to play around and to go to school if he has the opportunity to go to school and study.
At what age is decline expected?
Yes, once you reach the adult age, elderly age, once you reach 65 years and above, there's no matter how intelligent you can be, you start having decline. Because the brain is undergoing something called neurodegeneration, which has to do with aging. Some other factors can actually contribute, can accelerate it. Thereby you see people coming down with it earlier. And it bounce back to the genetic factor you talk about. Some people are prone to have disease called Alzheimer's disease, which is a form of neurodegenerative problem.
All right.
In this climate, what are the most common brain diseases that people experience?
Anywhere in the world is trauma, as Dr. Tabo said.
All right. Thank
trauma.
You. Thank you, Dr. Hafiz.
Yes.
Let me ask Professor Zamani, how early, should individuals begin to consciously engage in, brain health practices, and what are those critical stages of cognitive development?
Well, I think we have a controversial issue here, brain health and mental health. And I'm glad that we're discussing this on TV. And I'm going to present my own understanding, but leveraging on the initial comments that he made. That the brain is the central processing organ of the entire human being, and that is the truth. He also said there is an anatomical structure, and that is the truth. His approach to the first question that was asked was perfect. Let me start with brain functions. And in doing so, he alluded to so many things that are behavioral. For instance, emotions, sensation, cognition. I remember he talked about executive functions. All right, take the brain out of man, and there's no mental health, completely.
Yes, sir.
Just take it out of man, there is no at all. He was talking about planning. You wake up and you are planning. How do you plan? If we elect a governor now to run a state, and the guy is just behaving anyhow, the first thing to think about is his brain correct? You get the point? So the brain is so endowed with so much enormous powers that it enables us to be what we ought to be. Now, mental health is just the behavioral manifestation. And so to the extent that the medics are saying, look, let's isolate brain health from mental health, I would agree. I would give it to them. But you see, there's always a behavioral manifestation. Thoughts, feelings, sensation, reactions, these things, they stem from the brain. And that is why those of us in psychiatry and clinical psychology, are always very, very, very determined to ensure that the students that we teach know so much about the brain.
Yeah, Prof.
Yes.
Because if we continue in this controversy, as you put it, we may just end up going around and not dealing with the issues of. We'll get to you, madam. Sorry. If we continue like this, then we'll probably not get to the real issues that concern the brain.
It's
that's
for
why
public education.
we'll end up because I'm sure that he will hold his opinion, Dr. Tabo will hold his.
I think we are together. I think we are together.
But let's get to it.
Yes.
What exactly? I'm asking, at what stage should individuals begin to consciously engage in, healthy practices for the brain? And what are those critical stages of cognitive development?
Well, first, let me say that it all depends. For a child, a parent can create consciousness for brain health. For a child who is not knowledgeable, who is not that conscious, but could be made conscious by the parent. For instance, drug abuse education. Because drugs are toxins. They affect the brain. For instance, learning expressive emotions. The child probably doesn't even know that when he throws tantrums, that he's expressing emotions. All he knows is that he's using it as a means to suggest that he has a problem. But if you have a behaviorally minded parent, a parent who is really very conscious of holistic health, who takes the child through these levels of consciousness and awareness, the child grows up, knowing that, look, this is what I need to maintain brain health. So as early as people are exposed to information, they should begin to mind their brain health.
Brain health. All right. Yeah. All right. Thank you. You talked about smoking.
Yes.
Affecting the brain. I'd like to get to Dr. Otabo. I would like you to speak about some of the common myths about brain health. I mean, growing up, you hear children laugh at themselves. Maybe a child is dull. They tell you have a basket brain. Does the brain really leak? Is it that everybody is born with the same kind of brain, or there are differences? Speak about the common myth, really, that we get to hear about the brain and how it functions in different individuals.
Okay, thank you. Let me just dwell a little bit more on the care of the brain, because it's very important. The care of the brain actually starts when the child is in the womb, because almost half of the children that you see with neurological deficit, a child is born and then everybody is celebrating. 6 months, the child cannot hold his or her neck. 1 year, the child cannot crawl. 2 years, the child cannot stand, and then the child becomes a permanent liability to the parents. Many of the problems start when the child is in the womb. We call it asphyxia. Then also during delivery, if the child does not cry immediately, it's a problem. Oxygen does not get into the blood, and therefore the brain is starved of oxygen. That's a child with lifetime liability to the society and to the parents. And then sometimes a child is born, has a jaundice, and the parents are looking at the child instead of rushing that child to the hospital so that they can use phototherapy and treat or do exchange blood transfusion. If that jaundice is not properly treated immediately, it goes to stain the brain. It sticks to a part of the brain, and then that brain is permanently damaged. I can go on and on. Even some fever that you have in a 3-month-old child, infection. These are things that can translate into lifetime liability for the children. So parents should be very conscious of what's going on with their child. Even when if you see that your baby is not kicking, is not moving as it should, rush to the hospital. We may need to take out that baby on time so that the baby does not become asphyxiated. If you've noticed any little change in your child, you notice jaundice, you notice fever, rush that child to the hospital so that the child, because a young brain, a child with of less than 2 years old, if any insult happens to that brain, it's permanent. You can't do anything about it. And we have hundreds of thousands and millions of such children all over this country. Their fate is sealed. And this is one of the things that Engineer Chika is really worried about. When you see children who are disabled, they can't do anything because their brain has been condemned. Then as we get older, as the child gets older, you start, diet is very important. You have to give a diet that contains the B vitamins because it's good for brain health. Then you begin to teach, okay, look at, I see children, I see parents carrying their children in front of the vehicle without seat belts. That is disaster waiting to happen. Any small hit on that car, that child will hit his or her head on the windscreen or even thrown out of the vehicle. When he lands, the brain is injured. And when a brain is injured, it's a big deal. So it's part of prevention to prevent road traffic accident. Let's use our seat belts so that when an accident happens, it does not cause brain trauma. Then as the child gets older, as he gets into school, we start teaching the children how to avoid drugs, how to avoid substances that can affect the brain. Then this brings me now to smoking that you asked. How does smoking affect the brain? Smoking does not just affect the brain, it affects everywhere you have blood vessels. That means it affects the whole body. It affects the lungs, it affects the heart, it affects the brain, it affects the kidneys, because smoking tends to alter the nature of the blood vessels and it makes them thicken over time so that the normal flow of blood is disrupted. And when that happens, one is predisposed to stroke and even cardiac arrest. So there are a lot that is going on. People talk, you ask about the myth. Most of the myth has to do with the mind rather than the brain, the mental health, because people are raised under different circumstances. Environmental factors affect how the child grows up. Either the child is going to, whether he is going to be confident or going to be timid, whether the child is going to be depressed or is going to be overexcited. All those are environmental factors, not necessarily directly a brain issue, but rather a mental health issue. So it's good that, because we have discussed mental health issue on this your program before, and I believe today we are discussing the brain, and we must continue to respect that line of difference so that we don't muddle things up. I don't know if I've answered your question.
All right, thank you, Dr. Tabo. Now, Engineer Kwolisa, you've been itching to weigh in, but I hope we won't go back to the to that controversy between mental health and the brain health.
It's a problem. Yeah, I think it's a problem, really. We have to understand that in the brain, we have what is called, apart from the tissues or the cells and the neurons, you have chemicals in the brain. Those chemicals really is what, when it is not balanced, when it is out of balance, you have a mental health issue. When the chemicals in the brain are out of balance, you have what is called mental health issue. That is why you have people that suffer schizophrenia, that are schizophrenic, people that are bipolar, people that are depressed. This has to do with balancing, the chemical balancing in the brain. So we can't remove it. I tell people mental health is a fraction of brain health. You can't remove them. What is brain health, according to the World Health Organization? It's the brain functioning, we had cognitive, emotional, all whatnot, the motor balance and everything, even when the person is with a disorder or not, the person has to, attain its full potentials without, any problems.
All right.
That is what is called brain health.
All right.
So brain health is not an absence of mental health. They are all together.
Connected. Thank you very much, Dr. Engineer Okolita, for that. While Dr. Otabo was speaking, of course, we got some messages and we'll take them. But when he talked about trauma, a child falling, we know that when children learn to walk, they fall. So how much of that is too much? Because some parents may not just check, is a normal fall, a child will fall. But maybe you speak to us about that when the parent needs to take the child for examination when the child falls, while playing or whatever it is. But the questions that we have, this one says, my name is Destiny Happiness Peter from Calabar. My question is, how will you take care of your brain to pass your school exam? Another one says, good morning. I'm going through unconsciousness momentarily. Please, how would you help me? Okay, that's coming from Medusa. Unconsciousness momentarily. All right, you have some questions?
Yeah, I have about 3 here, and this one reads, good morning, NTA. Please, I have been battling with this condition for the past 3 years. I can't walk without someone holding me, on both sides. I'm even struggling typing because my hands are shaking and waist pain when I'm walking or sit for a long period of time. I've done all the necessary tests, MRI, CT scan, and the likes. I've taken series of drugs, but no improvement. Currently, I'm on prednisolone, Dexilant, and omeprazole. Please help a young lady. Sorry, my name is Ajoke from Kano State. Thank you, and I think she's left her number too.
Victor would not have made it in medical school.
No, I wouldn't. It's not my thing.
Anyways,
there are a couple others.
Been corrected.
One says, please, can our sleeping habits affect the brain function? That's from Olufemi Joel. And I like this program. I'm blessed with this information. Adibaya Success. Good morning, sir. My child doesn't cry or didn't cry when he was born, and he's getting to 2 years. He has not been able to walk. Okay? And finally, good morning, doctor. Please, my granddaughter has been watching children cartoons since before age 2. Now she will be 5 by August. She has not been able to say, I am hungry, or say, come. But she can sing all the cartoon rhymes. Whatever she needs, she will drag you to that thing. Currently, she is in behavioral and speech therapy schools. Thanks, Mr. Peter, from Agbara in Ogun State.
Dr. Hafiz, you want to handle some of the questions?
Yes. I'll start from with the last person. I mean, the last question read out. Yeah, that person actually needs to take the child to a childhood psychologist and a neurologist. The child likely to be having one of the childhood pervasive disorders.
Autistic.
Absolutely. So I think that's in response to that.
Beating a child when it doesn't cry at birth, does it correct that?
That's a very bad cultural, practice.
That's supposed to jolt the child to consciousness.
So you're trying to waken the child up with that.
But the first one was a lengthy one, but,
Yes.
The narrative of the young lady who says she can't walk without being held on both sides and is on medication, and then what?
Okay, the person that handshakes writing
Yes.
and has back pain, the person needs to see a neurosurgeon. The problem might actually not be from the brain, it might be from the spinal cord.
Does that also involve shaking of the hands?
It does. Once your handwriting is changing, you can't really hold the pen properly, and you've been normal or just that just started, you need to evaluate your spinal cord. It's actually like a telephone wire. You have to be examined so that it can be traced to where the problem is coming from. But for her to really be having waist pain, then we need to be sure it's also not having neck pain. Common thing that actually results into that is actually like patient has a compressive, a compression on the spinal cord.
What about the child that can sing rhymes but cannot ask for what she wants?
That's the one he addressed.
That's likely to be a
That's the one he
childhood
addressed.
pervasive disorder.
And someone is particularly requesting Dr. Tabo's line.
Okay.
But if he gives the go-ahead, then we probably will do that.
All right, you want to respond?
Yeah,
Prof?
I think this child who does rhyme and can't speak or can't communicate her needs may already be on the autism spectrum disorder. And it speaks volumes about the nature of environment in which this child is growing. An environment in which parents have hardly communicated. They have indulged or overindulged her with her preferences. Apparently, it was probably a kind of conditioning. Let us keep her busy so that we'll do our things. And now, because she has not had any opportunity to have any constructive relationship with, her significant others, she's pulled in. And the only thing she can communicate with is the stimulus that she was conditioned to continue to interact with. She really, truly needs
Attention. What do you need? What do you do to take care of your brain to pass exams?
Well, first, I think this particular student is not a diligent student.
So the student should read because we're out of time. Really,
she should study. That is one. And number two, learn also to identify her stressors and to seek help for them. And if she does that, she won't have test anxiety. She'll be able to pass her exams
all right.
anytime.
We have just about a couple of minutes. And Kolisa, in 1 minute, please, your final thoughts.
Okay.
So that we can get to Dr. Tabo.
This is World Brain Day activity that we are holding. And World Brain Day theme for this year is Brain Health for All Ages. Brain health for all age. When you talk about brain health, you are talking about the whole central nervous system, the brain, the spinal cord, and the nerves. So we just have to pay attention to preventive measures when it comes to these organs of the body, because the burden it comes with when it is diseased, when there are disorders, are enormous. We don't have the infrastructure, we don't have the professionals, though we have them just a bit in the urban areas. No, we have to do a lot of work. We have to strengthen the infrastructure.
Exercise help your
then
brain
the
health?
Workforce too, the neuroprofessionals, they are very few still.
I think, and the exodus is also affected.
We have a lot to do when it comes to protecting our people, our citizens from neurological conditions.
All right, thank you, Engineer Kolisa. Dr. Tabo, please, in a minute, in fact, we have less than a minute to go. Your final words, and someone was requesting your phone line. I don't know if you give permission to provide it.
my concluding thoughts would be on prevention, because once anything goes wrong with the brain, it's a big deal, and not many people are able to win the fight successfully. So prevention, primary prevention, prevents anything that can cause damage to the young child's brain, like I've said before, prevents adults' brain insult by by avoiding drug abuse, reduce smoking or stop smoking altogether. And then if you notice anything that is wrong with your system and you are not coordinating well, or that headache has been on for too long, visit the hospital and get a brain scan. You might just be saving something. They say a stitch in time saves 9, and that's more important when it comes to brain and the spinal cord. Thank you.
Now, Dr. Hafiz, your final words as we round off. Does sleep affect your brain health?
Yeah, it does. It does.
Okay. How many hours of sleep do you require for your brain to reset?
Well, some people, it varies from individual to individual. Some are short sleepers, some are long sleepers, yes. But you need an average of between 10 to 14 hours to actually have for your brain to actually have a good mental health. Yeah, regarding prevention, public enlightenment is actually very, very important. Most people are not aware, like the hypertension she talked about, there's a risk factor for brain damage. So many people are not aware they're hypertensive. The people that are aware, they are not complying with their medications. It doesn't really have to do with poverty like that. So many educated people, baristas that have managed, they are not complying with their drugs. They take it when the BP only goes up, and when it's normal, they don't take the medication. Public enlightenment goes beyond what we are doing here. Marketplaces, motor parks, religious houses.
I think the first thing is to know your status. So awareness is key, and that's where people like Engineer Kolis are coming very much in all of this. Thank you very much, Dr. Haruna Hafiz, consultant neurosurgeon, National Hospital Abuja. Always a pleasure having you on this program.
Welcome.
Let me also thank Professor Andrew Zamani, Professor of Clinical Psychology. It was a pleasure having you, your time, your thoughts and perspectives. We appreciate. And let me also thank Engineer Chika Ukuolisa, Executive Director, Brain and Spine Foundation, Africa. Thank you for coming on the program.
You're welcome.
And finally, but by no means the least, Dr. Christopher Otabo, Consultant Trauma Surgeon. We thank you for your time and the thoughts. Thank you very much.
Thank you for having me.
All right. We pause here now for a break so that when we return, we take you to our second conversation, which is on the new APC leadership. Please don't go away.